Cervical herniated discs are common in people in their 30s and 40s, but active duty military service members often suffer them even at younger ages. In this video, I discuss what they are, how they occur, how they're treated, and why service members and veterans often have long-term problems from them. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue your orthopedic injuries are connected to your military training and service so you can get the compensation that you deserve. The cervical spine has 7 vertebral bodies, C1 to C7. And you start from the base of the skull, goes down to the thoracic spine, 1, 2, 3, 4, 5, 6, 7. And while there's 7 cervical vertebrae, there's 8 pairs of cervical nerves that come out between each vertebral body. Each pair of cervical nerves emerges from the spinal cord, and they basically come out above their corresponding vertebrae. Now, an intervertebral disc is a cartilaginous structure, basically a shock absorber composed of an inner what's called a nucleus pulposus, and outer annulus fibrosus, and then the end plates that anchor the disc to the vertebrae. Disc herniations occur when all of the inner material, the nucleus pulposus, protrudes through the annulus fibrosus. You can think of it sort of as a jelly donut, and the jelly coming out of the outer layer of the donut. The displacement of the nucleus pulposus of that intervertebral disc can then cause impingement on the nerves as they come out of the basically what's called the neural foramen, the holes where the nerves come out, or they can actually, that inner disc material can actually compress the spinal cord. That's not the more common. It's typically more pressing on one of those nerve roots. Now, these disc herniations, it happens more and more as we get older, both in men and women. It's most common in people in their 3rd to 5th decades of life, so between 20 and 40. Chronic herniations occur more frequently as we get older, where that intervertebral disc starts to degenerate as part of the natural aging process. This degenerative herniation causes sort of gradual symptoms that are sort of insidious onset, less often severe. What military service members often get are what are acute herniations, usually as the result of a traumatic force, some kind of fall or something like that, that causes all at once that nucleus pulposus sort of extruding through the defect in the annulus of the disc, causing a sudden onset of fairly severe symptoms compared to what the older people get with chronic herniations. In the cases of an acute herniation, a lot of times it will go away, the symptoms will, over the first few weeks if you do nothing. It's those that don't get better with the non-surgical or the conservative treatments, again, usually 4 to 6 weeks, those are worth looking into further. Going to see the doctor, hopefully getting to see a spine specialist, getting x-rays, and more likely an MRI. Now, those that it's something else where, the doctor can rule out an inflammatory condition, malignancy, something like that, that's sort of a different story. But again, this acute radiculopathy, where you have an acute disc herniation, presses on a nerve root. Now it's causing pain that shoots down into the hand or fingers, numbness, tingling, weakness. Yes, the initial treatments will be non-surgical treatments, again, because a lot of times patients improve. It may be wearing a cervical collar. It may be anti-inflammatory medications. It may be physical therapy. It may be steroid injections that can be ways to avoid surgery. Sometimes, though, if nothing is working, surgery can be performed. And that a lot of times is not just removing that disc, the part that's extruded, but sometimes a fusion, what's called an anterior cervical discectomy and fusion. And the indications for that, that's where you have significant nerve compromise, significant pain, non-surgical measures just aren't working. Now, if you have ideas for future videos for this channel, whether it's Nexus letters or DBQs and the particulars of those, certain injuries, risk factors, whatever it is, leave those in the comments below this video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video. If you're interested in a Nexus letter for your injury or for your condition, click the link in the description below to learn more about working with me and working with my team. We do everything we can to make the process as simple and as quick as possible, and I strive to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to helping you.